Hello, I hope you're all keeping well, and as part of our informal talks I wanted to update you on information that's being received as to how COVID-19 is affecting the sensory systems. We've all heard that taste and smell may be affected by COVID-19 and could be a telling sign that we are infected. However, outcomes of COVID may be monitored for years to come in a variety of areas. It's still early in the development of COVID to know how many of these side effects are contributed to by the virus. We know that many of these symptoms experienced by people who were infected with the virus involve the nervous system. The complaints include breathing difficulties, headaches, muscle and joint pain, fatigue and brain fog, amongst others. What is becoming clear is that there are also many other difficulties which are emerging due to the virus. These include the three main symptoms of COVID-19 and are a high temperature and a new continuous cough, or a loss or change to the senses of smell or taste. However, there are also reports of the virus affecting other sensory systems, including hearing. Recently, doctors described a case of a 45-year-old man with asthma who suddenly experienced hearing loss in one ear while being treated for COVID. Whilst sudden hearing loss is rarely a symptom of the onset of coronavirus, developing hearing loss or tinnitus as a complication of the infection appears more common, even though it's still rare. And it's important to note that, whether related or not to the virus, sudden hearing loss is a medical emergency, and anyone who experiences it should promptly seek medical attention. Additionally, hearing problems can be caused by ototoxic medications used to treat presenting symptoms, as some side effects can include hearing loss, ringing in the ears, vertigo, or dizziness. Several medications currently and previously used to treat patients with COVID include remdesivir, chloroquine, and hydroxychloroquine, and they're ototoxic, in other words, harmful to the ear functioning. And this is something we've known about for many years. Indeed, Dr. Berard, the innovator of auditory integration training, identified hearing problems associated with some antibiotics in their early days of development. Neuroauditory deficits and some neurological symptoms were described as occurring 2 to 3 weeks after the onset of respiratory symptoms. Severely affected patients were more likely to develop neurological symptoms than patients with mild or moderate forms of the disease. We know that tinnitus is frequently linked to stress, and there's also some evidence that tinnitus is being exacerbated by COVID, as well as the measures helping to keep people safe, such as social distancing. In other words, by anxiety to do with what we're trying to do as the correct thing. Not only tinnitus, but also balance disorders such as dizziness and vertigo have been reported by patients with COVID. Since hearing and balance are related and share close areas in the brain, it's not surprising that balance may be affected. Social distancing and lockdown also seem to be affecting the sensory systems, and auditory processing problems may be more apparent now that people are required to wear masks and can't use facial expressions and lip movements for additional guidance and clues. Noise and distraction levels in people's home may be higher than usual when everyone is at home, making concentration and auditory processing more difficult for many. We have never been encouraged to do so many things with our eyes. We have literally become an online nation, since everyone is meant to stay at home, learn from home, work from home, most of it staring at a screen. Additionally, our entertainment is all on screens too, so that's additional pressure on our eyes. Vestibular exercises are not so easy to organise at home as they are outside or in a gym. It's clearly difficult to control our emotions when there's less space and distance from those who are close to us. We're hearing all the time about anxiety affecting not only adults but children too. When children start to feel anxious and their self-esteem is low, we know that this can lead to depression. This is surely the most important area where we need to offer help. We can definitely say that people contacting us are far more aware of their family's difficulties, often having been cooped up for weeks, as never before. We know that the senses should all be working together as a team, and one thing we can say is that over many years we've helped numerous people improve functioning of their sensory systems. Over or under sensitivity of the senses is an area that we can help with. Sound therapy can help to alleviate oversensitivity and encourage better hearing by stimulating undersensitivity. We're often told by clients that improvements are seen in their visual functioning or other of the sensory systems, such as touch, smell and taste. Equally, those who undertake light therapy may have improved emotional and circadian function, as well as better vision. Over many years, as you know, we've seen individuals' self-esteem rise and feelings of depression diminish, and now, more than ever, we are ready to help. We know that we are currently in the situation, and also know that at some point we will come out of this situation. Although at the moment we may not feel so, there is much hope for the future. Please feel free to contact us directly for more support. Be well and keep safe. Thank you.